California, AM 1220 KHTS. It's your host, Fred Arnold, on the Santa Clarita Valley Chamber of Commerce Business Spotlight, joined by Dr. Bradley Reid, UCLA Health.
That is correct.
All right, I'm a big Bruin, number 3 in the country, so I'm excited. I'm excited to have you on, just because you're from UCLA, right?
That is correct. That is
But
true.
you did do your training at University of Rochester School of Medicine and Dentistry?
Yes, that's where I went to medical school, and then I did my training in anesthesiology at Cedars-Sinai, and I did an extra year of training in pain medicine at Cedars-Sinai also.
Now, they call it pain management.
That is correct.
Nobody likes to be in pain.
Nobody likes to be in pain, of course. So one of the things that I do as a pain specialist is help patients address their pain via different modalities, ways to treat pain, including things like physical therapy, understanding the pain psychology or the psychology behind pain, lifestyle changes, things like what we call multimodal analgesic therapy, approaching pain kind of from all angles. And then also one of the things that I'm particularly qualified in doing is interventional pain, so minimally invasive procedures to address patients' pain.
I like that. A couple things you mentioned, minimally invasive procedures.
Yeah.
What do you mean by that?
Sure. Yeah.
More specific.
Specifically, we do different types of procedures or injections for patients. So injections into nerves, or what we call epidural injections, to help with either neck or low back pain. Also, we do joint injections. We do other procedures that are a little bit more advanced called rhizotomies, which we use special needles to create small burns on nerves that are causing pain for patients. So, we do a lot. There's a lot available, I think, that out there that most people aren't aware of to kind of treat your pain in the long term.
Now, I'm going to ask you some questions that kind of come to mind when it comes to pain, because sometimes when you're managing pain, you're just managing the symptom but not the cause.
Sure.
In other words, you're just blocking the pain. When I take aspirin, it's because maybe I had a couple whiskeys on the rocks, and the problem was I had the whiskeys on the rocks,
sure, right? Yeah.
And I'm just taking the Advil to feel better.
Yeah.
What about really changing the paradigm of getting behaviors to be changed, getting that natural healing that you get from exercise or being outdoors, or things that allow the natural side to happen?
Yeah, I'm really glad you brought that up. Number one, I think it's important that we understand that it's important, if you're having pain, to be evaluated by a physician, so that we understand whether or not the pain is something more serious that may or may not need to be corrected, either via surgery or other sorts of approaches. So number one, we have to make sure that it's not something dangerous. Mm-hmm. Once we figure out what the source is, then sometimes it's kind of that multimodal approach, understanding that we should probably get you involved in some physical therapy, some rehabilitation. And there are a lot of resources available here in Santa Clarita in the community, very, very qualified and trained physical therapists, occupational therapists that are able to rehabilitate you and patients to kind of find that way to adapt to the chronic pain conditions that many people experience.
Yeah, and so that comes to the next question I had, which is, you talked about the procedures, but there's this perception by some out there, by many out there, that, look, getting prescribed, the pharmaceutical industry is great because they help to manage pain, they come up with medicines, but am I just going to get some medicine to block it? And that sometimes doctors look at that versus the overall long-term, let's get this person off meds, let's get this person in a healthy place.
Sure.
There's that perception out there when it comes to pain management.
Most definitely.
That it's easy just to prescribe something versus to fix something.
I completely agree, and that is definitely one of the things that I focus on as a pain specialist at UCLA Health, is that we really try to help patients understand that we're not just covering up our symptoms by taking pills, but we want to help patients realize that there are more healthy ways to adapt to pain, and we can help you kind of come up with that approach for a more long-term, healthy coping approach to
almost like a strategy.
Exactly.
Let's not put you on this. Let's have a strategy.
Yeah,
I think that's so important in medicine.
I completely agree. Yeah, I'm not here to enable addiction, but I'm here to help rehabilitate.
Love that.
Yeah.
Love that. Let's talk about. We only have about 2 more minutes, but
Okay.
I want to talk to you about the weekend warrior. As an Ironman athlete, I sometimes have injuries, or as a softball player, you throw out your back. Boy, how do you prevent some of those injuries?
Sure.
because you probably see a lot of those.
Yeah, most definitely. So common pain symptoms or pain, I guess, presentations are those kind of shoulder pains.
I like the way you said
neck.
that. Pain presentations.
ways that patients present, right? Okay, that's a little clinical, I suppose. So I think when a patient comes to me and they threw out their shoulder or their back, it's important to kind of see a physician when you're having that surge of pain to make sure that something dangerous isn't going on.
Something more extensive.
Yeah, so things exactly. Yeah, so things that you want to be aware of are red flags such as weakness, numbness, or tingling in your extremities. Stuff that we need to really maybe evaluate a little bit further from a diagnostic standpoint.
And then the most important thing you probably recommend is just stretch.
Yeah.
Stretch, warm up. Move a little before you go out and decide jog 10 miles.
Sure. Core strengthening. Yeah. I recommend that to almost all my patients.
Big core strength.
Yeah.
Those UCLA Health, right? You're here in the Santa Clarita Valley.
That is
and
correct.
Throughout Southern California.
That is correct.
Those that want to reach you directly, Bradley, for Dr. Bradley Reid,
yeah.
for your consultation, how can they reach you?
So they can reach me via the UCLA portal or the UCLA website. Just go to UCLA Health and look us up. We're off of McBean Parkway. Available to help you with your pain needs.
Well, welcome to the community. University of Rochester, you're probably seeing a lot of cold weather.
Yes, I have.
Oh, it's beautiful out today.
That's beautiful out today.
Absolutely. Well, I hope you enjoyed this edition of the Santa Clarita Valley Chamber of Commerce Business Spotlight. You can watch us Facebook Live, KHTS 1220, and also at hometownstation.com. Until we talk again, make it a great day. This show is Fred Arnold on the Santa Clarita Valley Chamber of Commerce Business Spotlight.